You're listening to the Grit to Growth podcast. Real talk with real business owners and professionals who built their freedom the hard way and now want more time, money, and impact.
Hello, everyone, and welcome back to the show. I'm lucky enough to have two guests with me here today. I have Dr. Jessica Pearson and Dr. Cheryl Bones of Prairie Roots Health. Ladies, thanks for joining us and our listeners today.
Thanks for having us.
Thank you.
Yes, before we get into what you guys are doing together, if you wouldn't mind giving us a little bit of personal background on each of you.
I'm going to let you start since you kind of got the business going in the first place.
So I'm a functional medicine chiropractor, and I've been in practice for over 10 years now, and really started with kind of my health journey and some other families' health journeys as well, and really wanting to help people on a deeper level, really knowing and trying to get to the root cause of their health problems and myself as well. And that has just led into my passion of really promoting root cause medicine. So that's kind of where it started, was just that passion. And then I started out as a practice, left that practice, and really decided that I couldn't work for anyone else. And I started my own practice, and then it led into working with someone else and starting a group kind of project in how we brought in other providers to collaborate. And then that led into having Dr. Jess. She moved back to the area, and I've known her. She was my sister-in-law's best friend from high school, and also my anatomy TA at SDSU. And
oh, wow.
So it just comes full circle into us starting to work together, and then us realizing we wanted to take this idea to another level. Mm-hmm. And so it's just kind of come full circle in bringing Prairie Roots Health here. And now we are loving that. And
my background, the way I got here is not common, I guess.
Well, those are the good stories.
Yeah. I started out as an OBGYN, a board certified OBGYN. I worked in a traditional medical setting for 8 years. Prior to getting into all of this, I was actually down in San Antonio, Texas, working at Army Medical Center. I was active duty in the Air Force, and it was, the typical chaotic environment. I was running around in 10 different labor and delivery rooms. I was in the operating room. I was in the ER. I was training residents. I was doing all the things, like living off of caffeine, basically. And I loved it until COVID hit. And then once COVID hit, it really just changed how I felt about the hospital environment.
Mm-hmm.
I felt like there was more that I could be doing, and I started diving into kind of holistic health and functional health for myself, for my own health, and fell in love with it. And as my time was coming to an end with the Air Force, I had to start looking for new jobs. And I didn't know what I wanted to do because I didn't want to go to another hospital. So I called Cheryl because I knew she was doing functional medicine, and we had about a 2-hour phone conversation. And she's like, "You should just come work with me." So it started out.
So if I had,
go ahead.
You were still down in Houston during COVID, then is that
San
correct?
Antonio. Yep.
Oh, San Antonio. Okay, Gotcha.
Yep.
And then, what is the year that you are calling Dr. Bones?
2022.
Okay.
No, it was 2021. It was 2021 because
Yeah.
I started my training then, and then I was done with the Air Force in 2022. So.
Okay.
Yeah.
That's lining up.
Yeah.
Okay. So, and then is that how long after the phone call are you deciding to make the move back to Sioux Falls?
Well, I actually started with just getting some functional med training because I wanted to make sure it was going to align. So she gave me the information, and I registered and started taking the classes to become certified in functional medicine, and just kept loving it more and more. And then once I finished with my Air Force commitment in June of 22, that's when I joined in the collaborative that she was part of at the time.
You started virtually.
I started virtually, because I was kind of on the road for a little while, and then moved back home a few months later. So
Very good.
2022.
Yeah.
And then we started our clinic together in May of 2024.
Mm-hmm.
Okay. Dr. Bones, would you mind kind of filling in everyone what functional medicine actually is?
Absolutely. So functional medicine is kind of what I mentioned before is root cause medicine. So we really pride ourselves in really addressing all of those things because sometimes right now there's a gray zone of what functional medicine is. And we really practice and preach root cause medicine. So what does that mean, right? So people come in with symptoms of headaches, gut issues, hormone imbalances, skin issues. There are so many different factors, and every single person is so individualized in what is causing their problems that we work with that person to figure out what that is. A person will say, I want my hormones checked. Okay, we will check your hormones, but also we're not going to prescribe something or recommend something without addressing your nutrition, your movement, your sleep, your
All
community
immunity
support,
support,
your
stress,
spiritual,
yeah.
all of those things. So we look at
Okay.
if you look at like a
Love the
tree,
tree
yes,
analogy.
I know you do. A tree, right? What does a tree have? It's you see the beautiful leaves and the branches and the trunk, right? So you see all that beautiful stuff, but underneath is the root. And if you don't have a solid foundation, that tree isn't going to grow and prosper. And so when we really look at everything at the root, then it's all of those factors. Again, you can look at nutrition, the soil, the environment, the stress on the tree. We need good and bad stress for something to grow. So what does that look like? So we look at all of those variables and really truly look at all the variables with every single patient that comes in our door.
Amazing. So can you walk us kind of through, obviously, like you said, there are so many variables. How does one get started and down that path then?
Yeah. So with our office, we like really long, detailed visits. So we are because of that, we don't accept insurance because insurance prevents us from having those long visits. But our initial visits with any of there's three of us that do functional medicine, is about 90 minutes.
Okay.
And we dig through an entire health history and lifestyle history. Like, what are your habits? How do you live your day to day? What kind of barriers do you face? Like those kind of things to see like what we need to work towards and helping them make the changes that need to happen to see the results.
Very good.
But yeah, so they can get in with an initial visit, 90 minutes long, and then from there it's kind of just depends on what they need. So we have some people who just need kind of a little nudge to get going. And then if they just need some follow-up, we have a health coach that they can work with to just check in periodically and make sure that they're staying on track. If it's more medical related and they need prescriptions and things like that, we do have a membership option too, where they pay like a flat monthly fee to have as like unlimited visits and communication and access to wellness therapies that we have too. So that's kind of our structure for our
Very
business.
cool. Yeah. And then I think you guys made it pretty, this is primarily, or is it only for women, correct?
No.
No.
Mm-mm.
Oh, okay. All
No.
right. Talk me through that. What does your kind of client base mostly look like then, and what are you doing for the different kinds?
Yeah, I think that I made that image accidentally here just because my background is an OBGYN, but I'm the only one that's
Okay.
only women.
Mhm.
So that was kind of like the fault of me becoming a business owner here is it's like, oh, the OBGYN is there, so it's all women. No, not at all. I'm specific to those, but Dr. Cheryl and Sam, our new male nurse practitioner we just hired, they both see men and children.
Yep.
And women too. They see anybody.
Yep.
Oh wow. Okay.
Mhm.
So and is most of your client base family oriented, so you're getting everyone, or is there a
We have a
specific?
we have a range. So we also have another chiropractor here as well. I do chiropractic care as well as that other chiropractor. So we have that as well. But I always say the person that I want to see is someone that is wants to make those changes, that are willing to do the work and put in the work. I will see anyone that's ready to do the work. But whether it's male, female, 6 years old, 90 years old,
But you do tend to get a lot of families.
yeah,
So, I mean,
Okay.
Sam will too, you'll see, you'll hear
the
kids in there
Mhm.
she'll have a family in the room for, I don't know, hours sometimes because she's going through all of them, back to
Yeah.
Yeah,
back.
that makes sense. That makes
Mhm.
that makes per. Are you finding in families there's a lot of similar problems, or is it still very individual inside the family?
That's a great
Depends.
question. I think again that depends. My favorite answer from a functional medicine.
Hey, that's what I think it's better than putting a blanket statement
It
out there.
is because I don't like to say, I don't like to, like you say, blanket statements. Everyone is so unique in their history, their lifestyle, what has brought them to this moment. Um, you can see different family dynamics too, based off of the trauma that some of them have experienced, the food that they eat, the communities that they have. So there's different things and factors that affect all of those areas.
You do see trends though, which is interesting. That part's kind of fun. So, you know, there are some genetic trends that you can start to just see.
Yeah.
Like
Okay,
your mom has this. So I get a lot of moms and daughters, just
Yeah.
again, since I only see women, so I'll have some that um like I'll see the whole family a couple different times because they all come to each other's appointments too. So I have like a mom with two daughters and they've all seen me and they have a few similarities. Not they're all unique in their own way and they all have like kind of a specific problem, but underlying they have some trends and that's kind of interesting.
that makes sense.
Mhm.
You guys are obviously looking at all facets. Is there still one area that you're seeing is really improving people's quality of life? And maybe not just one area, but one that comes up more than others.
I
Yeah.
think we might have both
Yeah.
our own.
Our
Go
own
ahead.
passion.
Yeah.
We both agree on this. There's two things in particular. You lean more on one and I lean more on the other. I'm big on stress, really big on stress. And not just like emotional stress or whatever, but just like what does your day to day look like? How much are you putting on yourself, whether that's physically, mentally, emotionally? There's so many people who are pushing themselves to the max and they feel fine overall in the sense that like they get through their day to day, but then they have little issues that pop up. That's because they're just pushing their nervous system a little bit too hard. So I'm really big with the nervous system and the effects of cortisol and things like that.
I'm a chiropractor and I appreciate that because of the nervous system regulation. But the biggest passion for me is gut health. And those two things go hand in hand tremendously.
Which is kind of funny that I'm the
yeah.
nervous system one with the.
Yeah, it is kind of funny.
Is there, going back to both those, how, without giving away all your secret sauce, of course, gut health and then stress, do you have any good recommendations for listeners to maybe either identify when that's happening and maybe some small fixes or anything like that?
Yeah. With our technology today, we have a lot of really cool resources, and there's a ton of people who have devices. Like, I mean, I have two. I have a Garmin and an Oura Ring. But people have all these devices and they don't really know how to look into them. So I would say if you have a device already and you're trying to watch your health, really learn what that device is trying to show you. It has really great insights. I'm a big believer in them.
Yeah, tools
Very
like that are
simple
really
start.
popular, becoming more popular. Trackers. You can data to track and keep you accountable is really, really helpful. From a gut standpoint, really getting to the foundation of really good food and whole food. So the more we can have whole food, the better. I am by far from perfect, but I have a family and I'm busy and I still prioritize 4 out of 5, probably 5 days a week that we get really good whole food for my family. And so whole food, balancing stress, and just diversifying the food that you eat. And if those things don't work, then come see one of us and dig deep.
Yeah.
Very good. So you would never, you know, you hear these trends such as a carnivore diet and stuff like that. That is something that you would not recommend, I'm assuming, correct?
Not
It depends.
necessarily. It depends. Carnivore diet can be a really, really good tool as a reset. It's not especially for women, meant to be a long-term thing, but it can be a really good reset to kind of see yourself what food your body reacts to or does not like or has issues with. Elimination diets, we love elimination diets, so you can learn how your body is responding. That's the biggest thing is we don't want people to see us for the rest of their life.
Mm-mm.
We want people to learn how to balance what they know about themselves and really connect with their life and their own health.
Take charge of it again, take ownership, and not need to keep coming back. I mean, obviously, we love to see our patients and we want them to stop in and say hi, but the goal is for them to learn enough that they can just live sustainably without further issues.
You guys are preparing them, giving them the tools to take charge of their own functional health.
Yes. Yep.
Cool. Well, what's kind of so how many years have you guys been in business now?
With Prairie Roots Health,
Year and a half.
a year and a half. Yep.
Year and a half. Very
I've
exciting.
owned my own business since 2019. So that's 6.5 years now.
Crazy to think about.
It is. Yep.
So year and a half in, is there anything kind of on maybe the very near future and then the bigger picture that you guys are excited about?
We can't give away those secrets.
We are excited about, we can talk about Sam.
Oh, yes.
There we go.
We're really excited about
Sarah.
Sam. Just because from my standpoint, I'm comfortable in the women's health area, and having become certified in functional medicine, I can see men and children. And I was starting to lean towards it more just because I saw a need, but I really didn't want to. So for me, I'm very excited to have Sam because I can just stick with my ladies and he can have all the other patients, like the men and children and stuff like that.
Okay, Sam is your registered male nurse that you guys brought.
Nurse practitioner.
Nurse practitioner. Okay.
Yes. So he can prescribe, and he does well child visits and men's hormone health and all of that stuff. All the stuff I didn't want to have to do.
So how large is your team? Obviously, you said the three of you. Is there other moving parts inside the business?
There's another chiropractor, Dr. Sarah, who's amazing. And then, so total staff and employees, there's 9 of us.
Yep.
Okay.
We have a phlebotomist, we have a nurse, and then we have other support staff.
And a health coach.
Yeah, health coach, which is also in the office with me a lot.
Is there some ways that Dr. Jess, I know you said you couldn't really stay in the hospital, and Dr. Bones, you were saying that you couldn't envision yourself working for someone else. Is there kind of what flavor have you guys brought to your business that differs from those two paths?
Oh man, we definitely.
That's a loaded question.
Yeah. It was kind of interesting when I was in the hospital and she was on her own, because we still communicated because her brother married my best friend, and I'm kind of unofficial family member. But we had a lot of disagreements in the beginning from the visions from the hospital setting and the chiropractic setting. So it's been kind of fun to merge those things a little bit. There's a lot that we both had to learn, really. I had to learn to step away from like the medications and the literature and stuff a little bit, and like expand, be a little more flexible in the things that aren't studied as much. Because of the way I'm trained, if it's not in the literature, it's not medicine kind of thing. Well, in functional medicine, a lot of stuff's not studied because it's lifestyle. Like you don't really study.
You don't monetize.
It's hard to make those. Yeah, it's really hard to. So it took me a while to wrap my head around that and realize like you just have to experience it and live it a little bit. And I had to do some stuff on my own. And then for you needed to hear some of the stories and the patient experience that I had in a hospital setting.
Yep. It's kind of cool how we've come into the middle together, because from chiropractic can be more of a crunchy, what they call crunchy world.
There's no pun intended in that, was there?
There wasn't, but there can be. But people are very, very holistic, and sometimes to a fault, and where they will refuse medications when those can be a really good tool. And so that's what I love about blending this, is finding the right tool for the patient based off of their genetics and their lifestyle, the things that they've already done or tried, and learning from each other, because at the end of the day, it's not about what happens or what works for us. It's about the benefit of the patient, and really just getting them to be healthy and to the next level. So, that's really, really fun to be able to learn from each other and grow and provide that support for patients.
Amazing. If our listeners or anyone wants to kind of find out more about you guys, where you located, feel free to promote and where they could get the best education on you.
Yeah. I mean, we have social media pages and we have our website. And then, I mean, honestly, just stopping by and saying hello and checking out our building too, right next to Sky Zone.
Right next to Sky Zone off of 57th and Louise. And like she said, social media, we also have a really great newsletter, I think. And so if you go to our website, you can get subscribed to our newsletter. So we try to put some educational information in there and just current happenings as well.
Awesome. Well, thank you, ladies, so much for coming and sharing with myself and then our listeners what actual functional medicine is and what it looks like. It sounds like you guys have a very clear and good mission that you are accomplishing.
Thank you so much. We're excited to help people.
Good. Well, thanks again, and thank you, everyone, for listening. We will see you on the next one.
Know someone with serious grit and a great growth story? Send them our way at grittogrowthpodcast.com/guest.